So we're going to talk a little bit about the feeding the dependent resident skill. Prior to beginning, the test observer will explain that there will be an unopened food container that needs to be fed to the actor, or the actor will be fed an unopened food container. It can be pudding cup, it can be yogurt, applesauce, Jell-O, but it will be a single serving unopened food cup. Also, the actor will drink liquid. The liquid will be in a 240 milliliter glass, but the liquid will only be half full, or 120 milliliters. In other words, the cup will start out half full at 120 milliliters. There'll also be a diet card on the tray, and that's how this skill will start. Hi Simone, it's Vicki, your CNA, and I'm here to help you eat.
Okay, thank you.
I have your food tray here, Simone.
Thank you, I'm starving.
I'm going to start out by sanitizing my hands, covering all surfaces till they're completely dry. This skill doesn't require I pull the privacy curtain, but if I pull it, it's no points taken off. That's okay. It's just a habit for me. So I'm going to pull the privacy curtain as far back as the test observer has instructed me to pull it. And I'm going to go grab my supplies. So I need a clothing protector, and I need a two washcloths actually. And I'm going to head over to the sink to get them ready, and I'll be right back. All right, I'm going to get my washcloth ready to wash my actor's hands. So I'm going to wet it and wring it out and put some soap on it. Doesn't require a rinse, but if you want to rinse, that's okay. But it doesn't require it, but it does require a wash. So I have wet and soap on there. So I'm going to head back and my dry. Okay, Simone, we're going to start out by washing your hands. And here is a washcloth with soap in it. So I'm going to wash them for you because you are a dependent patient and you are not able to do this on your own. Okay, now I'm going to dry your hands. Now I could use hand sanitizer for this skill, but if I use hand sanitizer, I have to rub it into the actor's hands. I cannot just squirt it into the actor's hands and expect them to sanitize their own hands because this is a dependent patient. So if I used hand sanitizer, once again, I have to rub it into the actor's hands. For AMTI, we are going to advise you to use soap and drying the actor's hands. That's what our preference is, but State Board allows either one. Okay, so I'm going to now raise the head of her bed because we don't want her to choke when she eats, so we're going to raise the head of her bed a minimum of 45 degrees. All right, that looks like she's at least 45 degrees, if not more. And I'm going to sit next to her at eye level. Okay, so we're going to put on your clothing protector, Simone, to keep your clothes clean. Okay, there you go. You're welcome. And then I'm going to look at your diet card, and it says Simone, and you're on a regular diet. Okay. So we have pudding for you today and water. I'm going to open my food container. All right, we're going to start out with a little bit of pudding, chocolate pudding. I'm not going to overfill my spoon, and I'm not going to feed her overly quick. I'm going to give her time to swallow and chew if she needs to. Would you like some water?
Thank
And I can put a straw in there as well if that makes it easier. And the glass. And a little more pudding.
Yes, please. Simple. Thank you.
Okay. Okay. So I'm going to take her clothing protector off. I'm going to leave the head of your bed elevated, just so it just helps with digestion. I'm going to clean your mouth. Your hands didn't seem to get soiled. I'm going to dispose of my clothing protector.
Thank you.
You're welcome. There is your call light and water within reach. If you need anything, let me know. And then I'm going to record my food and fluid intake. Now I'm going to calculate the percentage eaten and the amount of fluids drank on my recording sheet. And it was about half, it was half full at 120 ml, so it looks like she drank about 40 milliliters. So under intake, I put 40, and then I can either write milliliters or circle milliliters, so I'm going to circle it. And then the percentage eaten, it looks like she ate about 25% of the food. I'm going to remove the spoon so you can visualize it. Looks like she ate about 25%. So 25, and there's already a percent sign there, but if I want to write another percent sign, I can. I'm going to close out my scale by sanitizing my hands, covering all surfaces until completely dry, which they are. I'm going to take my recording sheet and hand it to my test observer. Thank you. Skill complete.